The news for South Mississippi continues. The 4 o'clock show, sponsored in high definition, exclusively by the WLOX News and Weather mobile apps. Download and update yours today.
Well, our next guest has been a doctor on the Mississippi coast for several years and recently opened a new practice in Ocean Springs. Dr. Michele Hughes joins us now to explain the Mohs procedure in the treatment of skin cancer. And of course, Dr. Hughes, a dermatologist here in South Mississippi, and thanks for joining us today.
Thank you so much for having me.
And I know the Mohs procedure has been done for a number of years, but I had always heard about people having to leave town or have special doctors come in to different offices to have it done, but you take care of that locally now.
I do. It's a great option for skin cancer treatment. It's definitely less invasive. 1 out of 5 Americans will get skin cancer care, and it's so important to be able to offer those services in your office and not have to send patients out or make patients wait to have that procedure done. And we do offer that over at Premier Dermatology.
And the Mohs procedure, from what I remember about it, you go in and you remove sections that are cancerous, and then you go back and look under the microscope immediately and keep the patient there, and you keep going back and forth. That way you don't have to just take a big chunk out of it if it's not necessary.
Correct. So it's a skin sparing procedure, which is so important on the face when you don't have much skin to spare. And so we're able to track it out under the microscope while the patients wait, allows the highest cure rate as well as the best cosmetic repair in the end.
And how important is this as far as making it available here? I mean, I know that the option is a bit available, but it's nice to have a doctor that does it locally as well.
Well, I think that there's a couple of reasons that it's important. Number one, we're not making patients wait for their procedure. We're able to offer it right away. Skin cancer, when you're able to treat it in a timely fashion, has a very high cure rate. And then the other thing is we're available for any complications that may occur after the procedure.
Now, is this primarily for basal and squamous cell?
It is. And those are the 2 most common skin cancers that we see, and it's an excellent choice for those cancers.
And what are some of the things people need to keep in mind? We're looking at some of the charts now that show some of the irregular lines and different things that you need to look for at any time, really, that you have something pop up that's unfamiliar.
Right. What I always tell my patients is that if you have any spot that's sore, bleeding, growing, not healing, don't hesitate to let your doctor know, because that's usually something that needs to be brought to our attention.
And as far as the Mohs procedure, I know you said it's less invasive, and of course that's really important when you're talking about skin cancer on the face, where it's going to be, the scar will be seen. Are you seeing a big difference as far as is it less scar generally for people when they have this procedure over the older procedures?
Well, it's typically a smaller scar, which is always a nice option. The most important thing is the cure rate is higher with this procedure.
All right, Dr. Michele Hughes, a dermatologist in Ocean Springs. Thanks for joining us and sharing this important information, really important everywhere, but here in South Mississippi where we have sunshine so often.
Yeah.
Thank you.